What exactly is a stem cell?
Yeah, so I think when people think of stem cells, they usually think of like the baby, right? Like this stem cell thing that comes from a baby and that can maybe help to repair tissue. Like most people have probably heard of like umbilical cord stem cells, where it's like, after you give birth, they can store it or they can freeze it. And then
Yeah.
so it's like, why do they freeze it, right? What's that? What's the point of that? And so obviously, even 20 years, they started doing it like 20 years ago. There was a reason, and the reason was because there was this promise that maybe we can use these stem cells one day to help heal tissue. And back then, we thought that you can only use your own child's stem cell. But the whole idea of the stem cell was basically it can help to regenerate or repair damaged tissue. And so the concept of repairing tissue is very exciting because instead of having to cut things out or instead of having to take drugs to manage symptoms, you can actually repair
Hmm.
tissue. You can actually repair tissue. So it's very exciting. But there was a lot of controversy back in like the mid 2000s and like late 90s because there was something called embryonic stem cells, which is where they actually make like a fetus. And then so you make it in like a petri, like in a test tube, and then you literally take the stem cells from the embryo, and then the embryo basically dies, right? And so obviously that was very controversial.
Ah,
And so that's why, yeah, and that's why there was so much like heat about it. Like a lot of people and things except they're like, oh, are babies being harmed? Like, are you harming babies and stuff
yeah.
like that? And so it's not like that at all anymore because obviously that's unethical and no one is using embryonic stem cells. We're primarily using umbilical cord stem cells, but there are different types of stem cells. Like you can even get them from your bone marrow, from your fat. Just so people understand, there's like two broad categories. There's adult stem cells, and then there's what's called perinatal stem cells. So perinatal is pretty obvious, right? It's like all the tissue that comes after birth. So that's like placenta, amniotic fluid, umbilical cord tissue, and umbilical cord blood.
Hmm.
So there's all these products that used to just get thrown away, but now we don't throw them away. We actually collect them, we manufacture, we isolate the stem cells, and then we can, literally we distribute and sell them, and we inject them and use them for all sorts of things.
Whoa. So that's not just the umbilical cord, that's the placenta as well?
Yeah, so that's actually
Wow.
that's one of our best products. Is It's called purified amniotic fluid. So it's the fluid that's from the amniotic like sac, obviously, and then you isolate the exosomes. And the exosomes are like these little messenger cells that decrease inflammation and help with aging, oxidative stress, and all these markers of aging. So a lot of people use it just for anti-aging. Tony Robbins wrote a book about it and just like he's been promoting it a lot. And he's actually like one of our people who uses the product and like people like that just they do it every 6 months just for anti-aging and longevity purposes.
Okay, and what exactly are they doing?
Yeah. So what happens? So there's 7 or 8 hallmarks of aging. So as we age, there's a lot of different reasons why we age. I won't go into all of them, but basically one of the main reasons why we age is stem cell exhaustion. So what that means is when you're a child, you have about 200 million stem cells per cell, and then by the time you're 80 years old, you only have like 1 million stem cells per cell. So so
Okay.
you're going from like 200 down to like one, basically from maybe to like 80. And so it's called stem cell exhaustion. So basically, when your body's stores of stem cells get depleted, you don't have the same regenerative capacity, obviously, and your ability to fight infection, immune system, lots of different, because stem cells have so many different roles, your ability to regenerate and repair tissue, DNA damage, fight off infection, fight off cancer, all that stuff just decreases because one of the reasons is you don't have as many stem cells. So now
Hmm.
we can do what are called intravenous stem cells. So they go IV and they go through your whole body and they help to replenish those stem cell stores. So that's what all like and
Oh.
so that's what I would say all the wealthy people are doing now. Basically, if you have the money, you're going to do it because it can help you live longer and there's no downside. So